heads of state and government, Her Excellency Rebecca Akufo-Addo, First Lady, Republic of Ghana, Madam Deputy Secretary General, Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, Mr. Alex van Trotsenberg, Senior Managing Director of the World Bank, Ministers, Excellencies, distinguished delegates. I warmly welcome you to this high-level meeting under the overall theme of universal health coverage, expanding our ambition for health and well-being in a post-COVID world. Before proceeding further, in accordance with General Assembly Resolution 75/315, I first invite the high-level meeting to turn its attention to the draft political declaration entitled Universal Health Coverage, Expanding Our Ambition for Health and Well-Being in a Post-COVID world, the text of which was transmitted to member states by the President of the General Assembly in a letter dated 1st September 2023. Pursuant to General Assembly Resolution 75/315, following the approval of the political declaration by this high-level meeting, I will submit it for the formal adoption by the General Assembly. May I take it that the high-level meeting approves the draft political declaration, which, pursuant to Resolution 75/315, I will then submit for the formal consideration of the Assembly? I hear no objections. It is so decided. I congratulate all member states on their approval of this draft political declaration, which I will submit to the General Assembly for its formal adoption at a later date. Allow me to express my personal appreciation to the co-facilitators for the negotiating process, Her Excellency Carolyn Rodriguez Burkett, the permanent representative of the Cooperative Republic of Guyana, and His Excellency Suruya Chandawangs, permanent representative of Thailand, for their skillful stewardship and dedicated hard work, which has brought us to this significant outcome. I also extend my sincere thanks to all member states for their flexibility and constructive engagement. Allow me now to make a statement as President of the General Assembly. Excellencies, distinguished delegates and guests, our world is in a very different place today than it was in 2019. As the COVID pandemic reminded us all too painfully, healthy people are the foundation of healthy societies and economies. Today, we are here to scale up our actions and investments in universal health coverage, to ensure that everyone receives quality health services when and where needed, without incurring financial hardship, and to ensure that no one is left behind. Indeed, health and sustainable development are two sides of the same coin. As an issue that cuts across every sustainable development goal, health tells us how well we are delivering on our entire 2030 agenda, from ending poverty and tackling climate change to building safe and peaceful societies. Yet today, the growing burden of out-of-pocket expenses has become a significant barrier to healthcare access across the globe. Every year, millions of people are impoverished by the costs of healthcare. High costs keep essential health services out of reach. There is no reason for this to be the norm. Excellencies, by expanding primary healthcare interventions, national healthcare systems can better cover the costs of essential healthcare services. This could potentially save 60 million lives by 2030. Strengthened in this way, health systems could better help communities respond to and recover from shocks, all while preventing backsliding on health outcomes. I call on governments to increase and improve the quality of their healthcare investments, prioritizing equitable access and financial protection. All stakeholders must be involved, from government ministries and civil society to patient groups, providers, and citizens. Our focus must be on serving the most vulnerable, persons with disabilities, indigenous peoples, mothers, newborns, and children in particular. And while keeping a gender perspective in mind, countries also need a well-equipped healthcare workforce with fair compensation and decent working conditions. The political declaration just approved seeks to correct course and to identify a path forward for achieving the health and well-being of people everywhere. Excellencies, rapid progress towards universal health coverage is ambitious, and it is achievable, as many countries will showcase today. We can and must do better. Together with the political leadership from the top down, we can ensure that everyone has access to the health services they need. These are not simply matters of health. These are fundamental issues of social justice, equity, and human rights. Let us work together to radically transform our health systems and create a world where health and well-being is no longer a privilege for the few, but a respected right for all. I thank you.